Welcome back. Now in this video, as a continuation of fluid and electrolyte management of a patient, very important topic is clinically whenever we are attending a patient in triage or in a hospital setting or in a clinic, how to identify whether patient is in volume deficit or volume excess. There are a few symptoms and signs. Usually the patient presents to us whenever he or she is in volume deficit, and similarly there are other symptoms and signs whenever volume excess is there. So in this video we'll quickly go through the various signs and symptoms of patients presenting with volume deficit and patients who presents to us with volume excess in order to plan the management of these type of patients as early as possible. So let's start with this discussion, the fluid and electrolyte management. Now these are the common systems usually get affected whenever a patient is presenting to us with any kind of volume disturbances. Volume disturbances obviously can be of broadly two types: the volume deficit or volume excess. Normovolumic means everything is fine as far as the plasma volume is concerned. So symptoms and signs of volume disturbances. Usually the commonly affected systems are: patient may present to us with generalized symptoms. We'll discuss this. Patient may also have some cardiac symptoms. There are various symptoms. We have grouped them together in the form of the common symptoms related to these systems. Patient may have gastrointestinal symptoms, and sometimes they may present to us with renal impairment or renal symptoms and signs, and along with pulmonary systems and sign, right? So the first one is the generalized symptoms. Whenever a patient is presenting to us with volume disturbances in the form of volume deficit, like patient may be having diarrhea or continuous vomiting or decreased intake, all these things may lead to volume deficit, especially on the chronic basis. Acute loss we can also take here, but usually these symptoms are present whenever there is continuous slow loss. The volume deficit, the patient will present with the decreased skin turgor and decreased weight loss. You can remember this by the down head arrow. The weight is decreased and skin turgor is decreased whenever volume deficit is present, and this is a generalized symptom, right? At the same time, whenever volume excess is there, patient can gain weight, puffy face, all the symptoms of weight gain will be there due to excess volume. Peripheral edema. On examination, this peripheral edema can be there, right? Pitting type, And after that, let's go to the cardiac one. The cardiac symptoms could be like if the patient is presenting to us with volume deficit, patient may have tachycardia, increased pulse rate. Increased pulse rate. Pulse rate will be increased in case of volume deficit related to cardiac system. And two things are decreased. What? The neck veins, the veins present in the neck, they are collapsed. As well as the blood pressure, it may be low. Hypotension will be there, right? Or stasis will be there. So volume deficit patients, tachycardia means increased pulse rate, less of BP and neck veins collapsed. Whereas in volume excess, the cardiac symptoms could be increase in cardiac output, increase in central venous pressure, and neck veins are usually distended, and presence of murmur may be there, right? Appearance of murmur in case of volume excess, pulmonary edema, and all these things. Finally, affecting the cardiac site, leading to presence of murmur and increased CVP. And the third affected group is gastrointestinal group, GI group. Whenever a patient is presenting with volume deficit, the patient may have ileus, less of motility of gastrointestinal tract. The mobility is, the peristaltic movement is reduced in case of volume deficit. Whenever volume excess is there, patient may have edematous bowel. The edematous bowel will be there in GI tract, right? And as far as the renal system is concerned, any patient presenting with volume deficit, they will present to us with decreased urine output, known as oliguria. And at the same time, the blood urea nitrogen in the blood will be increased, right? Less of excretion is being done due to decreased glomerular filtration rate, GFR, right? So oliguria, less of urine output, and increased blood urea nitrogen. Volume excess patients usually no specific signs and symptoms. In pulmonary system, usually whenever volume excess is there, patient usually present with pulmonary edema, and as well as all the features of sometimes congestive heart failure secondary to this pulmonary edema. Volume deficit, there is no specific sign and symptoms related to pulmonary system whenever patient is in volume deficit. But yes, these are the common symptoms and signs what we have discussed whenever a patient present to us with volume disturbances. So okay, in next video we'll be continuing with the discussion. Any query you can write to me. Thank you so much.